Hello. Hello. We might be going back to the old way.
It's working.
Is it working now?
Yeah.
Have we started recording? Is there a finger up, Colin? A thumbs up?
Yeah.
Perfect. Welcome everybody to the November Health and Wellbeing Board. So first thing on the agenda is item number 1, which is can we agree the minutes of the last meeting held on Wednesday the 11th of September. Is there any comments or questions from anybody about the minutes? No? Fine. We'll take that as a record that they're true then. Thank you very much. Second item on the agenda is apologies for absence. I'll hand over to James, who will say that now.
We have received apologies from Lee Edel, Councillor Caroline Ellis, Professor Daniel King, Councillor Lynn Schuller, and Melanie Williams. Thank you, Chair.
Sorry, Chair, could I just add Councillor Wheeler's apologies to that as well?
Jonathan Wheeler.
Yeah. Noted.
And Chair, Councillor David Walters is ill.
Thank you very much.
Okay.
Thank you. So item number 3 on the agenda, does any councillor or officer have any interest that they'd like to declare or disclose before we start? Oh, Councillor Wilmot.
Yeah, just to say, I don't know whether she should be declared or not, but my daughter works for the NHS.
Any other declarations? No? Well, let's continue then. So item 4 on the agenda today is, and the first proper item is the Nottinghamshire Health and Wellbeing Review. I hope you can see that we're all sitting slightly differently today, which we've taken on board some of the feedback we've had, and Lizzie and Viv are going to go through the next stages and what we've done. But first, I'd just like to say thank you engaged with the review, and we are listening, and I think you'll see some of the things that we're doing that will hopefully make it a more inclusive strategic partnership that we want it to be. So thank you so much for everybody who's taken part in the review, and especially to Lizzie and Viv for all the help in helping to do the review. So without that, shall we, before we do that, shall we do the recommendations? I formally do the recommendations. Can I have a seconder?
Yes, please.
Thank you. Right then, Lizzie, shall I pass over to you?
Thank you, Chair. So hello everyone. As Bethan's introduced the item, I'm just going to give a brief overview of the paper that's been shared around the Health and Wellbeing Board review. So just to start off with a bit of background, in July, Nottinghamshire Health and Wellbeing Board agreed there was a timely opportunity to review how it operates, understand how it could deliver its responsibilities most effectively in the new health and care system, and using its long-standing position as a strategic partnership to improve the health and wellbeing of local populations and promote prevention and equity. So this original agreement included agreement to seek support from the local government association, the LGA, who offer established methods for reviewing strategic boards. So we began the review with a survey at the end of last year, which ran until January, to capture the views of current board members, ex-members and supporting officers and directors from member organisations. And those initial results were used to guide a LGA facilitated workshop held on the 13th of December. This was followed by a series of one-to-one conversations in March, which further explored the views of a selection of current and ex-board members and system leaders about what changes we could make and how they could be implemented, building on that initial survey and workshop. LGA associates led those conversations, and I think that was really valuable in ensuring an independent assessment of the board was undertaken, and that knowledge of best practice regarding workings of other health and wellbeing boards could be applied to that as well. After reviewing the outputs of the survey and the workshop and those discussions, the LGA's primary recommendation was for a refreshed agreement to be reached on the board's function before considering its form. There was lots of feedback that came through around form, but it was important to establish that element first. Was the primary recommendation that came through from them. that we started exploring that in a further workshop, which a number of people around the room today attended on the 30th of September. So I think I'd just like to take this opportunity to reiterate Councillor Addy's thanks for everyone engaging in the review to date. As the constructive feedback received will support the board to continue to improve its impact going forward. The report you've received provides a summary of the key findings that have been captured through those various engagement activities I've just described, including the latest workshop. As previously mentioned, this slide essentially highlights the principle that the LGA have reinforced through their work with Nottinghamshire Health and Wellbeing Board of form follows function and the need for feedback to be addressed sequentially. So essentially it's outlining that the board must first establish a shared understanding regarding its role and purpose in order to inform where it should put its focus in the immediate term and in strengthen its identity as a strategic partnership. So that will mean establishing a joint understanding of what the board is seeking to achieve and individual, organisational and collective responsibilities of members in supporting that and setting that culture of shared responsibility. That will in turn support the board to prioritise its focus and strengthen its identity as a strategic partnership, in particular its distinct function from health scrutiny. So having a clear view on what the board can uniquely offer will support with identifying 1 to 2 priorities that all partners can coalesce and collectively add value around in the immediate term, which was a really key bit of feedback that came through, I think, from the latest workshop discussion. Work to identify those 1 to 2 priorities would start to address some of the other themes that are outlined in the report around effective use of available data, seeking to reduce duplication and further clarifying how the place-based partnerships and health and wellbeing board relate to each other, because that prioritisation will need to be informed by evidence need as well as what's being delivered by other local partnership structures in order to understand where the board is best to focus its attention, as well as the element around seeking to reduce duplication. It will then be possible to address feedback relating to the form of the board that's been highlighted by clearly establishing the unique role of the board within the local system and a more focused set of priorities. It will be possible to take decisions around membership, frequency and format of meetings, including how best to engage residents in the board where they have an interest, such as through workshops and stakeholder events. I'm now going to just pass over to Viv, who's going to go through some of the next steps that we've have been identified from that feedback to seek board support.
Thanks, Lizzie, and thank you all for the collective work that's gone into developing this. Sorry, is there a funny... Let me just try turning this off and on again. Is that any better? I've got a few gremlins today. Maybe it's to do with my laptop. I'll pull that back. So in terms of next steps, really thinking around how we build on. I'm sorry, there is still a bit of a delay on that, isn't there? Okay.
Sorry.
Okay. No, that's great. Thank you. That's great. Thanks. So in terms of next steps moving forward, so we're building on the model that Liz has just shown us. One of the first things that we did talk about in the workshop is around developing that almost compact or agreement around how do we want to work as a board. So really thinking around what do we want as the culture of this board, how are we going to act within this board, and really taking back some of the feedback that we've had around how do we make this feel like a strategic partnership where we're really driving impact and change rather than feeling like some of the other broader council committees that we've got, acknowledging that they have a really important role and there might be something around how we work with those committees in a slightly different way around that. The key thing as well in terms of that is really being clear around what our role is on the board. And I think one of the things that we're really keen to think around is the way that we will have impact isn't about how we sit in this room, it's about how we take the actions outside of this room and go and collectively work with our organisations and use our influence and abilities to really drive that change for Nottinghamshire. So there will be something that we'd like to just pull out around how do we all agree on how we're going to work a little bit differently around that. The second thing is around building on what Liz was talking around in terms of how do we really understand what our priorities are for Nottinghamshire over the next, let's say, year or so, and so that we can be really clear around how we can add value as a partnership above and beyond our collective parts. Apologies, we've just lost the slides on that. Lizzie, do you mind putting them back up? Okay, no worries. And building on that, what I'm really keen to do and test with partners is around if we would be happy to slightly open up that membership for that meeting, because there's quite a lot of discussions around the broader strategic partnership review, and really thinking around what are the key priorities for Nottinghamshire. So we have a range of partnerships where we have many similar members talking about similar priorities. And how do we bring that together to have a conversation around what are the key things that we can deliver for Nottinghamshire collectively that will drive change and have impact in, you know, the shorter and the longer term. So if partners are happy with that, I can see a few nods around the room. We'd be really keen to work with yourselves around having that broader conversation around, yes, we need to be clear on what our priorities for the Health and Wellbeing Board, but actually what are our priorities for Nottinghamshire, and then that will also link into that strategic partnership work. The third bullet point that Liz was going to, that hopefully the slides will come up in a moment, is just around developing that broader work plan. So starting to make the change just in terms of physically, some slight changes to how we're positioning ourselves to start changing the culture around the meetings. But we know that there's more work to do in terms of really understanding how we're utilising all of our time in the most effective way, whether that's frequency, whether that's our use of JSNAs, whether that's how we're linking with our place-based partnerships and our districts and boroughs in a different way, but also thinking around, you know, what do we want out of this meeting? So there will be a broader work plan that we will make sure that we agree on with that. So those are sort of the key initial next steps. We'd hope to move on those within the next sort of early into 2025 to be able to make sure that we are keeping the momentum, because we're really keen that many people have invested a lot of time into this, and we're keen to make sure that we do deliver on those as soon as we can. So in terms of the recommendation then, so this is just the recommendation for the board in terms of supporting those next steps outlined in the paper, to think around how we can really increase that impact and effectiveness that we have as a strategic partnership to make the best, to really improve outcomes for our people of Nottinghamshire. So thank you.
Thank you for that. I hope you all are sort of on board with this, and it's such an important piece of work, and thank you so much, because I know it's been such a long piece of work as well. So I'd like to open it up for comments, questions to the room. Anybody like to say anything? Victoria.
I'll make sure I put my lid down. Just to really support the direction of travel, really. We've got masses of need in our local communities, and therefore masses of opportunity to do more where we've got the resources to do it. And I think in a very resource constrained environment that we're all in as public sector bodies and people committed to this agenda, coming together, making sure that we've got a combined focus on those things that are going to matter most to our local people is absolutely beholden on all of us to try to do that. I think there could be some complexity in the system in terms of the role of different organisations, and I think we're all aware, you know, we've got an integrated care partnership, for example, we've got the ICB, we've got the ICS, we've got a health and wellbeing board, you know, we've got our county, we've got a city, so that can create some complexities. But actually, I think what the opportunity is for us to have these really honest, open, real partnership, collaborative conversations to see what we can do together to add value, because we're all here for our local communities and the people that we serve. And I think it's a really exciting opportunity that we've got to do that. So fully endorse the direction of travel.
Thank you for that. Councillor Wilmot.
Thank you. Just a few observations. First of all, about the workshops. I think they really are good things, and all I'm looking forward to is the agreed principles are going to be delivered as soon as possible. As the report states, this committee agreed in July of last year to review how this board could deliver its responsibilities within the health and care system. One of those responsibilities is to reduce health inequalities, and this board should be leading the fight to reduce health inequalities that exist in Nottinghamshire. and Nottingham itself. Health inequalities in Nottingham and Nottinghamshire are still very high. In fact, they're as high as they've ever been, I think. Take, for example, my town of Hucknall. We were promised the new health centre over 3 years ago, and we still haven't had no progress. The Keble Centre remains paused. This means our two main primary care providers, which are Wyburn Medical Practice and Torquard Hill in Hucknall, are breaking at the seams. If the purpose of this board was to work together with partners to reduce health inequalities, then campaigning for the government to make progress on our Keble Centre should be a priority. We wrote to West Streeting now 4 weeks ago asking for an update, and yet he has not even bothered to reply. Other health inequalities exist, of course. Take, for example, the lack of progress on the rebuild of the City Hospital and Queen's Medical Centre, or the fact that people who live in Newark have no access to 24 hours health care without a 3-hour round trip. Now, looking at the key findings in this report, it is essential that all agencies on the Health and Wellbeing Board attend regularly, and if given a piece of work to attend to, they complete that work and bring the report to the next available meeting of the board to be debated. And of course, if the office is not available, then please send a replacement to give a report, or if there's no one available, at least send an update on the progress of the work done. If that's done, then it makes sure that we don't lose time in delivering the services. I agree we need to widen the partnership and establish its role in promoting prevention. Prevention, as you know, I talk about prevention every day of the week. Sometimes I get listened to and sometimes I don't. But prevention is the main object that we should be looking at the present time, because it keeps people out of hospitals if the problem is prevented in the first place. The idea of establishing a number of priorities, of course, what we've said, is absolutely essential. It's not sensible to have a large number of priorities with none of them being fully implemented, and that's easy for that to happen. If you have too many priorities, then many of them they don't get fully implemented. So it's essential that happens. A small number of priorities also reduces duplication, as we all know, and as the board has time to address and understand the work going on with the other partnerships. Can I say, improving partnerships and knowing how other partners are working enables more opportunities to be delivered. Engaging with residents is essential, especially when they have an interest, as many are living the experience of the work that we are trying to introduce. Yes, the work programme and agendas should not only be set by Nottinghamshire County Council, but other partners should be bringing forward agenda items, especially those things that are not working to improve the lives of our residents. It is also essential that we bring in experts that are knowledgeable in delivering specific services. It's also essential that we allow more time to assess how our work is progressing and exploring its impact through monitoring. As far as activities are concerned, I'm looking forward to seeing how the Family Hub will work through the Best Start partnership. It opened in Hucknall recently, and I was so glad you were there, and it was a marvellous event, and there's so many families coming, and that's what's got to happen all over Nottinghamshire, because we've got to start making priorities to make sure that families get the opportunities to learn how to bring up their children, and also the inequalities of health situations. It was great to see, and I congratulate everybody that was there, because and I'm sure it'll be outsourced to other areas as soon as it's found out to be such a tremendous success. It opened in Hucknall recently, and for what I saw, it was impressive. With all the people that were present were all partners. 11 organisations there. That's the way to get things done. But make sure that everybody is represented, and also be able to talk to people and make sure that every opportunity to get people doing the necessary work that's essential for our families. And I say, I shall be keeping a real eye on the presentations that are going to take place on the family hubs, because they are, I think they are the future. Thank you.
Thank you, Councillor Wilmot. I think the idea of partnership prevention is something that we all around here want to prioritise. So thank you for those comments. Viv, did you want to come back on some of the comments?
Yeah, I can do. Thank you. I think thank you for your comments, Councillor Wilmot. I think you raised some really important points there that I think will definitely be addressed in terms of some of the work that we'll be moving forward. In terms of some of your specific concerns in terms of healthcare facilities, it would be good for you to link with some of our ICB colleagues and potentially think around some other ways to get that information for you. Because one of the things that I do want to really highlight, and you mentioned it very eloquently, is around one of the key things that this board can really drive is around prevention and reducing health inequalities. Now, actually, the most effective way that we can do that is around the building blocks of good health and well-being. Because actually, access to health care services only actually contributes to around 10% of our overall health and well-being. So I think there is something around how do we absolutely acknowledge the absolutely invaluable role of health care services, but also acknowledge that we can do much more around that building block. So how do we make sure that we have good warm homes, that we have good education and employment opportunities for our people, that we have strong thriving communities, and that people have access to the services that they need at the time that they need them. So thank you for those comments. But I'm also really keen to think around how do we build on some of those concepts that you talked there in terms of prevention and equity, but also think about that in the broader sense of this partnership and how we can all add a lot more than we're potentially doing. And that links into your comment around the wider membership, that we might need to think around that too. So thank you.
Thank you, Sarah.
Thank you. Yeah, I think it's been fantastic having the LGA involved, and I think the process today has been really supportive, and it's really nice to see that we go along, we do a workshop, and then some change happens really quickly as a result of it. And while everybody might have got confused where they were sitting this afternoon, I think it is really important. Some of these things do signal that it is a partnership, not a committee of the county council, and I think that's really important. With that, I think in the report, the suggestion of the chair's report moving to a bulletin, I think is fantastic. I think the more that we can get out there in terms of what our partnership can achieve and is doing is really good, and that means that we can engage the public in a different way around some of these things. And also the opportunity to involve people when we're doing our workshops, particularly. I think as somebody who sits in 2 health and wellbeing boards, I have a lot more meetings to go to here, obviously, but I think the way that this board has created a series of workshops and the way that we do that, it's been invaluable. So the fact that, we can look to invite different people to different workshops for different reasons to bring that lived experience. Of course, I'm going to say that from a Health Watch perspective, because it's important to us that the lived experience of people using our health and care services are brought in. So I think there's some really helpful things. I guess one of the things that struck me in the workshop when we're looking at this challenge to look for 1 or 2, but 1 priority, is just how difficult that conversation was, and the level of competing priorities that we've got across the county. So yes, I'm absolutely supportive of that, and I'm just wondering if there's a potential for us to have a working group to even look at how to do that conversation, because I think it's a difficult one, and Viv's just highlighted the pressure we've got at the moment, coming up with winter pressures. It seems that that's all focused on health, and then consequently social care collapsing under the weight of what's coming, and we have to look broader than that. We have to look above the clouds, if you like, and to be able to understand what could we do as a board to shift the needle, if you like, in some of these very thorny issues. So particularly as you mentioned, Victoria, with the financial pressures coming, they're not going away, and the only way we're going to make any difference is if we work together. With all our financial pressures, without us anybody beating their chest saying ours is worse than yours, everybody's in a very difficult struggle. So I'm really interested to understand how our place-based partnerships can get involved and be part of the solution to looking at this single issue. to sort of sit above what are all the other strategic priorities that we've got, but something that we can be proud of as a county, to say we did that, because so much of what we do is a day in, day out shift and struggle that we've got to make. Whereas if we can actually just do one thing above all others, carrying on with everything else, it's not an all or nothing. But if we can do that one thing, I think it would really signal to people that there are agencies working together, there is a cooperation happening. So yeah, I suppose I'm offering myself, if I can be helpful to a working group to think through how we might look at how we create that one priority. I think it's something like, it's a call to action really for us to take what we did with the LGA forward and really come up with something. Otherwise, we're just going to be chasing our tails because there's so much we could be doing. So yeah, that's all I wanted to say. Thanks, Chair.
Thank you very much for those comments. I think I agree with everything you said, to be honest with you. And I think that one priority is about adding the value that no other group does. And I think that's what we really need to focus on. But I don't know if you want to add.
I am in complete agreement with what you say, and I think it's a really great idea to think around. We've talked about how we want this to be a partnership that is, we're distributing the leadership and we're genuinely all taking responsibility of that. And I think if anybody else is interested to get involved in that working group, if you can let me and Lizzie know, then we can start thinking around how we pull that together. I mean, realistically, it's probably going to be after Christmas, because if we're going to do it, we want to do it well. But I'd be really keen that if there are other people that would like to be involved, I think that's an excellent idea, and thank you for raising it.
Councillor Garland.
Thank you. I think my comment may have been sort of made, but the use of the word partnership for somebody like me who's not totally familiar with all the different organisations involved does sort of sound like a risk of duplication, which I think I may be misunderstanding on my part. But I think the points about reducing duplication and making a unique focus for this board, which has particular capacity because it particularly represents the councils who deal with all of us across the county on a daily basis in terms of the building blocks of health issues, I think is an opportunity to find a unique set point. Now, I'm not talking about actually sort of setting agenda, but finding something that's unique that's not going to be covered by anybody else seems important. Otherwise, it's just a waste of resources, isn't it? It's still got to be working with other people to make sure we're not duplicating, but I think that's critical.
No, thank you for that. Councillor Wheeler.
Thank you, Chair. A lot of the points that I was going to make have already been made, but one thing I will say in terms of communication, particularly with engaging with the public, ensuring openness, transparency and inclusivity is, if I was to go out on the street in my town and say to the average member of the public, do you know what the Health and Wellbeing Board is? They say, I ain't got a clue what you're talking about, mate. Yeah. So moving forward, I think some of the challenges that we've had as a board, because I've been on this board since 2015, which is quite a long time actually, is some of the work that's been done with the public has been done at times when the public aren't available. And it's been done in a way where you're not going to get maximum, the people that you need to be there, you're not going to get them there because of other issues that they're faced with in local communities. So in terms of inclusivity and tackling health inequalities, I think a lot of partners need to be thinking about how they work with the public in terms of what time of the day it is, when they're available, making themselves more available at times when the public are more likely to attend an event or engage with partners. So I'd be interested to see how that could be done moving forward in terms of tackling those inequalities in those communities where there are a lot of challenges, particularly with fuel poverty, food poverty, unemployment, issues around health. Because I think it's excellent we've got the family centres as well. They do an excellent job, but a lot of people that you need to be on board aren't on board because they don't know what we're doing. And I think that's because of the communication and also the fact that when we've had workshops in the past or consultations, people haven't necessarily known about them or been available at the times when they could maybe, we need to look at that because they've been like during the daytime, a lot of people are either at work or you've got children in school and it's quite difficult. The online engagement as well, sometimes it looks quite clunky and boring. I don't mean that in a nasty way, but it needs to be communicated in a way that actually the public are actually going to engage with it. It needs to be done in a way where it's going to be sometimes actually hard hitting in the context of getting the message across. So I'd be interested to see how we could perhaps look at that moving forward. So they're my comments, and I recommend the report. Thank you.
Thank you. Communication definitely is something that we as a whole we need to work on better, I think. Viv, is there any further comments you wanted to make on that one?
No, I think you made some really important points there, Councillor Wheeler, in terms around how do we genuinely co-produce what we are doing in this board with our population. So how do we bring them into the conversation, and how do we do that in a way that is meaningful, but is also in a way that picking up on other points around how we don't make sure that we're duplicating. So I think there's something around using some of the expertise of members in the group around who are engaging with our population on a regular basis, but thinking around what is the specific angle that the Health and Wellbeing Board can add value to. Because actually we've got Healthwatch doing some incredible stuff around engaging with our communities, but we might want to work with them in a different way around what the priorities are that we might want them to look at. So I think there's something for me around thinking around what is the unique selling point of the Health and Wellbeing Board, because I suppose my question would be, does it matter if everybody on the street doesn't know that we have a Health and Wellbeing Board, or does it matter that they're seeing change that's improving their lives? So I suppose there's something for me around how, when we work through around what do we want this board to be, how that we're going to develop that compact and almost that rules of engagement, that we work some of that out. So I've written down some of the notes, so thank you for that. So if it's okay, we'll take some of those points into that. But I think co-production and bringing our communities in, whatever way we think that is the best way to do, so we have meaningful conversations, is absolutely a priority. Thank you.
Victoria, did you want to come back on that one?
That's okay, just to kind of echo the point. You make a really, really good point. It isn't people in this room that are going to come up with the solutions about how we do things. It's by speaking with people, working with people. We don't do two. And one of the models about how do we support that integrated approach is the development of both place-based partnerships, but also neighbourhood teams who are closest to those communities that they're trying to serve. And it's about how do we, coming together as partners, create the environment for our neighbourhood teams and our place-based partnerships to really flourish and own some of that ability and responsibility to deliver things that are sensitive to local population needs. I think our role is about setting the framework for them to flourish. It's about setting the overall strategic direction and the prioritisation, but actually allowing them the freedom to get on and do the things that are best for those communities to achieve those outcomes. And I think it's kind of our challenge really is how do we create that to work in the best way that we can. But absolutely take the point, the co-production, the personalisation are absolutely the things that we want to work together on.
Thank you. Councillor Tideswell, did you want to go?
Thank you, Chair. I think what we must do from Borough Council point of view is we must make sure that the homes that they are living in are fit for purpose. And we know that we still have stock that we have to be working on, and not just in the council sector, but also in the private sector. We have a responsibility. Then when we look at further afield at the community, we need to make sure that we are approachable and they can come forward to us. We need to make sure that we are providing entertainment that is positive for them, not negative for them. There's so many things that have been neglected, especially from, say, 2016 to 2023. We know that the health service partnership was taken out from social services. That's one thing we should never, ever do again. We need to take stock and make sure that we are all working together as partnerships. That is our responsibility. So that we can make sure that everything knits together and we are listening to the community. so they can come, go to the doctors, or go to the children's centre, or go whatever proviso they feel happier with, which unfortunately we have been missing out of quite a long time since 2016. I hope now we are moving positively forward for our communities.
No, thank you for those comments. Helen.
Yeah, thank you, Chair. Just a couple of practical points. So, the County Council Partnership Review, is there a date where we hear feedback on that? Because I think that would be really helpful for the function of the board and all the other partnership groups within the county and beyond. And then a really practical point, building on Sarah's and Henry's point around the bulletin. I think there's a real opportunity in making the bulletin the way of communicating with the public. So the language that we use, and also maybe using the building blocks of health to structure that, so that we're starting to use very similar language and a similar framework, so that people in the community start recognising that. So just two really practical points. Thank you.
No, thank you for that. I think the whole idea of the bulletin was, so it was, if there's anything really serious, we'll obviously bring it to board, but if there's any, it's more of a communication for everyone to feed into, isn't it? Between meetings as well. So that's something that we can think about. Viv, is there anything else about the meeting dates?
So in terms of the strategic partnership review, I'd need to clarify in terms of what the exact date is the honest answer. Some of the conversations through the Safe and Not board have been looking at some of the community safety partnerships, and I'm sure that deadline is around sort of the end of the financial year. So I would hope that we would start getting some more information there, but I'll go back and I'll clarify that and make sure that that's circulated, if that's okay.
Thank you. Councillor Jackson.
Thank you, Chair. Practical again, same as Helen. One of the things I've struggled might not be the right word, but one of the things I've tussled with since I came to sit on this board was, what is my role and what do I take back to my district council? Now sometimes we'll get a report and it will be very clear what we need to take back, and I can pick out what bits are relevant to my council, but they're not all relevant. So for example, county administer education, district doesn't. So anything to do with education, I'm not going to be able to take back. So I think some clarity with some of the asks about what is it you want us to take back to our boroughs and districts, and how might we then bring the results of that back to this board. I do sometimes feel the communication isn't two ways, so more of a two-way dialogue might be helpful going forward, but some clarity about what is expected of me in terms of what I should take back to my district. I do take things back, but I'm kind of figuring them out for myself, so maybe some more guidance with that might be helpful. I'm not wanting to be spoon-fed, but some more guidance might be helpful. Does that make sense? Thank you.
No, it makes perfect sense. Thank you. Viv, do you want to come?
Yeah, thank you, and thank you for your honest feedback, because I think being open and honest is the only way we're going to make a difference here. So thank you for that. I think it's a fair reflection around that two-way communication, and what you will see in the appendix to the paper is Lizzie's done a lot of work with a range of partners, including the Joint Health and Wellbeing Strategy Steering Group, around how do we develop some of that performance monitoring approach. So how are we making sure that, yes, we know that we're going to have one or two priorities, but we're also having oversight of the whole of the Joint Health and Wellbeing Strategy. And I suppose there's something for me around that will also need to be something that we all own, because I'm not saying that there will be a role for your organisation in every single priority, but there will be roles for your organisation in there. And I think that's where it comes back to the conversation around what is our roles and responsibilities and what are our expectations for each other, to have that high support, high challenge environment, so that we can have those difficult conversations, but in a really positive and constructive way to enable us to make a change and really have that tangible difference. But we can certainly make sure that we take some of that feedback back, and think around how we do, as part of that roles and responsibility. I'm looking at Lizzie here because she's absolutely brilliant at this stuff. How we do put a little bit more support in terms of, this is something that you might want to consider and things like that. We can't tell you what to do, and we'd never want to do that, but I think there is something that we can think around in terms of, this might be something to consider. So yeah, thank you for that.
Yeah, absolutely. Just to support what Viv's just said, I think we're hoping that we should be able to get some ongoing support from the LGA as well up to the end of March 25. We need to sort of discuss the level of that resource, but I know they've been developing a lot of things in terms of guidance and supportive resources, so there may be something that we can explore through them as well and that side of things. And as Viv's mentioned, I think it'd probably be in the development of that compact there's something about including, I think, some tangible things in there about role as a member of the Health and Wellbeing Board. So yeah, absolutely, you can take that away. Thank you.
Thank you. Is there anybody else who'd like to say anything? Colin?
It's Colin Pettigrew, Executive Director, Nottinghamshire County Council. Really just, it's not a question, yeah, it's more of a reflection. Yeah, we talked about the LGA quite a bit today, yeah, and how we've benefited from that, which is undoubtedly true. I just wanted to kind of give a bit of a shout out to Lizzie, Viv, yeah, and yourself, Chair, actually, around the workshop worked really well, in my view. I felt engaged, I felt heard, felt listened to, yeah, it felt more like co-production. Yeah, so just wanted to say thank you to officers and indeed yourself, Chair, yeah, for the workshop in September.
No, thank you. I know, Lizzie, you worked so hard on it, so thank you ever so much. And I hope you can see we're trying to be more inclusive and more of a partnership. So I hope that's come across in everything we've done today. Are there any other comments, or are we happy to vote on the recommendations and then we'll move forward with the review? Is everybody happy? Can we have a show of hands? Fabulous. Thank you ever so much, everyone. So we'll move on to item number 5, which is the requirements for the pharmaceutical needs assessment in order to formally seek delegated sign-off of the draft and the final P&A to the Director of Public Health and Communities. Before I hand over to William, who will be outlining it for us, can I have a seconder, please? Thank you ever so much. Right, over to you.
Thanks very much, Chair. So, afternoon, everyone. My name is Will Leather. I'm a Public Health and Commissioning Manager at the County Council. So, the purpose of this item just really to summarise plans to develop the pharmaceutical needs assessment for Nottinghamshire, and as mentioned by the Chair, to ask that the Board delegates authority to sign it off to the Director of Public Health and Communities, to Viv. So, quickly by way of context, so all health and wellbeing boards, they have a duty to publish a pharmaceutical needs assessment, or P&A for short, at least every 3 years. The purpose of the P&A is about gathering data on existing local pharmacy provision and estimating the need in the local areas to identify any gaps or opportunities for improving services. Obviously, it's really important in terms of the role of pharmacies playing communities, often acting as that first port of call for residents seeking support with their health and wellbeing. So there's a real opportunity there, building on what we've just been discussing around partnership working. So we're working alongside Nottingham City's Health and Wellbeing Board to produce the P&A, and with support from an external organisation that have got some significant expertise in this area. So we've established a steering group which has met once already, and that involves key stakeholders including representatives from the ICB, from pharmacists and from GPs as well. So in terms of the request from this paper, so in order to meet the deadlines of publishing and delivering the P&A, we're seeking the boards to delegate its authority to the Director of Public Health and Communities. So that's not to say that the board won't be involved at all in the production of the P&A. Actually, there'll be quite a few opportunities for the board to contribute. So the first is we've got a survey that's currently live for all residents in the city and the county to give their opinions on current pharmacy services. So after this meeting, we'll make sure that we send around a link that you'll each be able to access, and I'd be grateful if you could share that among your networks so that we get as many residents completing that as possible. Then there'll be another opportunity. So when we've got a draft assessment, that will be open for a 60-day consultation between May and July next year. So members of the board will have the opportunity to comment on that. And then a further item, once we have the final P&A and that's published, that will be brought to members to consider how the board can support the findings and really think about the so what should we do with the information, how can we have an impact on outcomes. So that's all I was going to cover, but happy to take any questions or comments.
No, thank you very much. Any comments or questions, Victoria?
Yeah, thanks. I know from history dealing with these is not an easy thing to do, so you have my sympathy, and it's really great work. It was just a query, really, given the fact that we are thinking about how our communities need to be much more engaged, and thinking about you know, pharmaceutical community pharmacies are really, really important as part of a whole range of health and care support services that are offered throughout an extended period of the day. And increasingly that will become much more important, particularly with independent prescribers coming on board as well. I was just curious, I know you've got a core membership of ICB, it feels very kind of clinically oriented into the membership. Just wondered, is there an idea to maybe go to the place-based partnerships to share some of the early considerations and thoughts to get a broader church of input into the development of the PNAs? It would just be a really good opportunity, I think, to get that broader view about what would a local community find really helpful from a more than just a clinical, very medical perspective. That was all.
Yeah, absolutely. I'd be happy to come along to the place-based partnerships to talk about this a little bit more and seek your views and kind of influence what's going on. I think the fact that there's also a primary care strategy that's being developed is a really good opportunity for this to inform that and sit alongside it. So yeah, certainly I think the role of the place-based partnerships will be important. So happy to come along and get some comments. Thank you.
Tim?
Yeah. Thank you, Chair. Very much on what Victoria said in terms of, she mentioned about independent prescribers. When we look at the previous PNA, it's with reference to advanced and enhanced services and being more. What we can challenge ourselves to be ambitious because the workforce changing, in terms of becoming independent prescribers, and also what's happened over the past 3-4 years is the role of pharmacists in terms of being more proactive in active case finding, whether it's high blood pressure or in other areas of looking at health promotion. So I think we can look at a bit more ambitious in terms of what we do. And like a GP surgery, again, a pharmaceutical is a physical location in almost every neighborhood that the public identify as well. So we've got to utilize that space as well in terms of how we address health inequalities and address some of those gaps which we've discussed. So yeah, very much supported and invite you to the place-based partnership meeting. So yeah.
Yeah, if I could just respond to that. Yeah, definitely. I think challenging ourselves is really, really important. I think when we set out on this work, we knew that there was a kind of minimum requirement that we need to produce a PNA, but actually, you know, working ahead of that and thinking, well, now we've got that document, what can we do with it to kind of push forward and go beyond? So I think that will be the paper that will come back once we've got the PNA and with the board thinking about, you know, how do we build on things like pharmacy first and really using pharmacies as, like you say, they're embedded in communities, but respecting the challenges that they face in terms of funding and staffing issues. But yeah, certainly I think let's try and be a bit more ambitious.
Helen?
Thank you, and thanks, Will. Just two quick points again. Very welcome to come to Southwark's Place-Based Partnership, and I know in the 4 neighbourhoods that we're specifically working in one of the areas, the pharmacy is quite a hot topic, and that leads me to my second point, which is Sarah might want to say herself, the Health Watch hot topic is pharmacies at the minute, so that's another, we've got some great information that will come through that to link in as well, so building on Victoria's point. Thank you.
Thank you. Viv, did you want to go?
Yeah, thank you, and thank you, Will, and the broader team. I think this is really helpful and comprehensive paper, so thank you for that. I suppose what I'm just thinking around is how we're building on the conversations about ambition around pharmacy. So I suppose what I'd just be really keen to think around as we're developing the PNA is how do we consider what the art of the possible is for pharmacy in terms of prevention and reducing health inequalities? Because as has been mentioned here, these are absolutely critical in our community infrastructure, and are we really, it'd be really good to understand if we're getting the most out of the opportunity that brings. So I suppose there's just something, and we can pick this up outside if helpful, Will, around, are we really clear around what the preventative offers are within those pharmacies, and are we clear on where we would like it to be? Because I think if we're genuinely thinking around some of that system transformation, we could be pushing the boundaries around where we're delivering services in a different way, from a public health lens as well as from a broader system lens. So I'd be keen to make sure that we unpick some of those broader preventative services as part of the PNA if we can do. That's okay.
Thank you. And Councillor Garland.
Sorry, a few questions. Just for picking up on that, actually, just a minor point. I'm looking at the survey. It doesn't actually mention vaccines as one of the reasons, and that was the last reason I went to a pharmacy. I think maybe if we want to use this to inform the public as well as ask them questions, ordering the questions to start with for advice might be better, but I appreciate that may be too late, and sorry to get so down weeds. I just I don't want to be sort of picky, but I just wonder why we're delegating authority for something that's decision is going to be made in next summer. It seems why would we do that? It doesn't seem like there's a time critical issue here.
So the PNA is a statutory responsibility of the Health and Wellbeing Board, and we've got to publish it by the end of September. Correct me if I'm wrong. So if we're completely honest, the only reason why we're doing that is to allow us to have flexibility in terms of the timing. So it's a little bit similar to the approach that we've agreed with the BCF, where if the timings don't quite work, then we can ratify it afterwards. So there's something around making sure that the Health and Wellbeing Board is absolutely brought along on the journey. And it's almost, and then we will have a conversation around what the implications are. So it's really around just smoothing the process, rather than taking away any responsibilities or anything, because it's just more of a practical thing, because sometimes the board meetings don't align.
And I would add that since I thought of that question, you have reassured me we are going to see it, because having looked at the last one, it's a fascinating document, huge amounts of work to collect. I can see that. I can see that there's an external company involved. Can I just ask, how much is that costing? Do you know, to get them to do that? Thank you.
So I don't have the exact figure with me, but I can find it out and let you know. I can assure you, though, that they are very experienced. We've spoken to other health and wellbeing boards that have used their services in the past, and they've come with a thorough recommendation. They're led by pharmacists by background, so they really know what they're talking about. But yeah, I will find that out and let you know.
Victoria.
Yeah, just I kind of welcome the lead-in time. To be honest, I do take the point. It's really important that we do a very thorough and robust PNA, because a lot of our community pharmacists will refer to this, and a lot of large corporate organisations will refer to these to find opportunities to build local businesses. And so there's a very real commercial reality to the information provided, and it's open to significant review and challenge if it's not correct. So it's really important that we do take the time to make sure it's as robust and the information is as complete as possible. Once it's published, it's there for that period of time, which is a live document, and it's open to challenge by people who may perceive that it's in their commercial interest to do that, as well as the right interest for patients. So I think it's the right thing to do to make sure we do it really well.
Yeah, no, absolutely.
Thank you, Councillor Wilmot.
Thank you, Chair. Can I say I've recently done a survey, went around all the pharmacists and asking health problems with health problems, and I was genuinely thought tremendous, because many of the pharmacists seem to be really experts in that field now, whereas a few years ago it was very difficult to find somebody who could diagnose some sort of stuff to give you to help in the situation. But it seems to have improved a lot. I'd say that there seems to be a general improvement in my area, although one of our big pharmacists closed, unfortunately. Was attached to one of the health centres, which was all of a sudden it closed. I don't know. Anyway, although there are some concerns that remain, paragraph 5 of the report said that the pharmaceutical needs assessment is a report used to identify any gaps in current services on improvements, or that could be made in the future on pharmaceutical service provision. I really believe that there needs to be more accountability. I really do. For example, when we as councillors, independent councillors, raised issues with significant queuing at a pharmacy in Huthwaite in Sutton, with the ICB, we were told to go straight to the pharmacy. But when we did, we never received a reply about the situation at all from the pharmacy. While this report speaks on the situation generally, it doesn't mention issues with individual pharmacies closing at short notice. Because in our area, one day a pharmacy was open in Selston, and then the next day it was closed without knowing the full facts behind the situation. Obviously, in general, however, most of the pharmacies are good on stock, but there is times when people go to having got a prescription, repeat prescription, they find out they can't get it at that time, and they have to start ringing round to find out where somebody that's got it because they need it urgently. I just wondered if it's possible for pharmacists to let surgeries know if there's a certain issue on a project that's vastly used in the area, if that could be put around so that people will know whether it's available or not at the pharmacy. I think that's a really big human point that we need to address. But as I say, otherwise, the other position was injections for flu and COVID. I think there ought to be a report to say that every pharmacy does the same thing, because you go to some pharmacies, they do flu jabs, others do COVID, and oh no, you've got to go back to your surgery. But when the surgery doesn't know about the pharmacist whether he does it or not, so they need to work together much more, better. Thank you.
Tillen, did you want to come back?
Thank you, Councillor Wilmore. I'll just put my GP hat on from a GP surgery point of view. I think by and large, pharmacies work very closely with the GP practices, and drug shortages are difficult to predict, so it can come at various times. But in general, there is closer working with GP surgeries and identifying the sort of shortages and doing, and also ahead of, for example, Christmas coming through, avoiding the big bank holidays and doing so. They do work very closely with surgeries in terms of getting prescriptions in place as well. And there is a network of practices to that. I'm assuming that's what you were referring to in terms of.
I'm just saying that what happens on a number of occasions, and I'm not a pharmacist, I'm not a health person, knowing a lot about it, but people keep ringing me up and saying that there's a problem. The surgery has given him a prescription and it's not been available. All I'm saying is it'd be nice for the pharmacist to let the surgery know that it's not available at the present time, and so you might be able to deliver some other projects.
My only comment on that would be, as I suspect, it's very, without knowing the individual incidences, that probably the individual should reflect back and feed that back onto the practices. So the practice should be able to work with that pharmacy in identifying where the shortage was. So because it's a very generic comment, I can't say specific scenarios. There could be lots of reasons, but I think it's reflecting back onto that individual to work with the practice, and then the practice can work with the pharmacy. Thank you.
We'll work more closely together to make sure that. But a lot of people, of course, have got disabilities, and if they're walking from the surgery to the pharmacist and back again and back, it's just not acceptable.
So just to come back onto those points, so I absolutely accept around pharmacies closing, and especially at short notice, I think that's happening across the board. Unfortunately, the pharmacies closing or reducing their hours. And in terms of some of the issues that you've identified, that's exactly what we want to try and capture in the survey. So, what is it that residents are finding frustrating with pharmacy provision that we need to address? What is it that's working well? So, absolutely, let's try and capture that and include it in the P&A so that we can work, together with GPs, with the ICB, with all partners to try and address them.
Thank you. And Sarah.
Thank you, Chair. Yeah, as Helen's point, Healthwatch has got a survey out at the moment, which is looking at community survey. Thank you for that, Helen. Very timely plug. And one of the issues that we are looking into is when people have concerns or difficulties in accessing different types of drugs in their community pharmacy. It is an issue. So I would say please fill in our survey and encourage your constituents to fill in the survey. And I'm also on the steering group for this. So, Health Watchers involved will bring our data and our intelligence into that conversation. So that would be useful. And I think, there are issues that go beyond what we do, which moves into health scrutiny, which is where we're looking at some of the issues that you've raised around, the difficulties people are having and there's national issues of drug shortages, how that's then passed on to the public in terms of understanding how to do that. There was a huge thing on migraine medication not that long ago, and nobody could get hold of a particular over the counter, let alone what GPs prescribe. So, there's things that we need to keep an eye on, and that's one of the reasons why this is an issue that Health Watch has taken on. We choose our surveys quite selectively in terms of what we want to look at, comes from the level of concern that's been raised with us through public experience. So, we'll absolutely feed that into the development of the PNA. And I think really, having an approach, as Victoria said, in terms of being able to future-proof what we need for our communities is going to be really vital. And what I would say back to, districts and looking at high streets and the way that high streets are being challenged, this is key really in terms of where are those prime sites where pharmacies feel they've got a commercial ability to run a business, how that works with your district planning, how it works with what you're trying to do for your high streets. Again, this is a real life example of why this partnership is really important when we're thinking about something like pharmacies. You think it's a health issue, it's not. It's a high streets issue, it's a accessibility issue, it's a health inequalities issue. So in that sense, we're really pleased to be involved in developing the PNA. And I think, we have to have as much input as we can to make sure that businesses feel enabled to deliver what we need our communities to receive, and that it's future-proofed in terms of what's happening generally within our local economies and the input that people are needing on the prevention side. I think Vib's absolutely right. When you see pharmacies that have been really involved in prevention, and I had the privilege of being a chief executive of a charity for many years that worked directly with pharmacists, as we recognised them as the front line for prevention and self-care. And when the self-care agenda came out, it was pharmacists were the first place people go before they go to a GP, and it was about how we can harness the experience, knowledge, and insight that pharmacists can bring into a community to encourage people to do all sorts of things within their locality. I think is something that we need to ensure the PNA enables.
Thank you so much. Victoria, did you have a comment?
Just very quickly, because I think it was eloquently put there, but it just really makes the distinction really about scope and opportunity. So the PNA is about understanding where we need more pharmacy capacity in our communities. That's a very different issue from the way that pharmacists are commissioned and the way that the contract works. So just be really, really clear that those are two different things. And you're absolutely right, this is a high street issue as much as it is a health issue. And we need to be really mindful, I think, within this community of the Health and Wellbeing Board of the scope of this focus is more that development of the community response prevention. It isn't to create another health scrutiny opportunity. So we just need to be really careful that we don't start reading one responsibility into another is a bit of a plea, really.
No, thank you. Will, did you want to come back on anything? No. Councillor Tideswan.
Yeah, just a quick note. On Friday, I was asked to go and pick up a prescription for a friend. The pharmacy didn't have that medication in. But the guy before me, he'd actually been to 3 pharmacists that day. He hadn't got transport, so he had to walk all the way around. Luckily enough, I had got transport. So I was able to another pharmacist to tell him it was big enough to have the stock. And And the other thing is, Boots are actually closing some of their branches as well. So we do need to be well aware of the problem. They're going to be coming like banks if we're not careful.
No, thank you for those comments. I think with regards to access to pharmacies, I think what I'll do is speak to the health scrutiny chair and see if there's a conversation we can have and bring it to health scrutiny if that's all right with you. So I'll do that after this meeting. Are there any more comments? Councillor Gall.
It was coming back to what you said about the vaccines. So I noticed when, or somebody asked it, when we went to book a vaccine, they're only available in very limited sites, and it looked like it had been directed to be the sites that were in the areas that were in most need and where the residents were least likely to travel, which I thought that's a great bit of planning. Was that deliberate, and do we have that sort of level of control, or was it just the market forces somehow?
So I'm not 100% sure. I'll look through it in case she knows any more.
So that would be dependent on how it was commissioned. So sorry, my apologies. Public Health don't commission them, so I don't want to give you the wrong information. So I'm going to hand over to Victoria. Are you okay to cover that one?
Yeah, it's probably a bit of both. So when you have the P&A, what that indicates is where a gap in the market might exist. So that allows an opportunity for a commercial entity to enter into that space. That's why it's really important that when we're developing the P&A, we have to talk to other local pharmacists as well, because of the commercial advantage that you have by having a geographical area, you know that you can sustain your business because you've got a population size likely to come to you. So if we start allowing spaces that more community pharmacists come into, you deplete the opportunity for them to remain viable, and that's why we have to be really careful about how you assess where the gaps are. Now, increasingly, what we want to do is get into a space where we're happy to, shall we say, encourage a very strong market where we've got the greatest health needs. So where we can identify in areas of more deprivation, so that it kind of avoids that issue of people who can't afford transport having to travel around. We really do want to encourage that, but it has to be within a framework that is reasonable and not overly contestable, shall I say. So this is really, really difficult. And just as a point of kind of information, really, there is a national contract around pharmacies. So we as an ICB kind of hold the contract and manage those contracts on behalf of NHS England, but we don't have an awful lot of scope to change that national contract. So we have to work within the sphere of control that we've got. And many of the issues that have been talked about are things from a national supply chain of drugs, again, over which we have no local control. So I absolutely do recognise the challenges that people are saying, but I want you to give some assurance that we are aware of those. We try to do our best within the limits of our areas of responsibility. We'll continue to work in partnership to identify where those opportunities can be. We can influence and nudge behaviours for the benefit of local people, but it is within a broader context, which is why, you know, that point about this is a bigger issue than just a health issue within our sphere of control. Okay.
Thank you for that. I don't think there's any more comments or anything. Thank you so much for all the information and for answering the questions. And if you share that link with us, I'm sure we'll get it out to the community. So can we just vote on the recommendations then, please, with a show of hands? Thank you very much, everybody. Right then, let's move on to item number 6, which is the Better Care Fund. The report provides an overview of the performance outlined in quarter 1 and quarter 2 of the Nottinghamshire Better Care Fund reporting templates that were submitted to the NHS England on 29th of August and 31st of October, and ask the boards to ratify the templates. Before I hand over to Anna, can I have a seconder for the recommendation, please? Thank you. Over to you.
Thank you. So I'm Anna Oliver, Group Manager for Adult Social Care Commissioning. So just a little bit of an overview for those of you who might not be quite so familiar with Better Care Fund. Better Care Fund was established in 2015, and the idea is it's pooling budgets between the NHS and the local authority to reduce some of those barriers, so some of the things that we've been talking about, and improve that partnership working. And some of those barriers previously existed due to having those separate funding streams, so it pulls some of that funding together. And it's around being person-centred, so to improve our practice and the experiences and outcomes for people. And as a system, we submitted our annual plan back in April time, and that's what we're now working to. And this body approved that back in July. Alongside the Better Care Fund for the last 2 years, so this year and last year, we've also had an additional grant, which is our discharge grant. And the focus of that is around supporting that hospital discharge pathway. So there's some additional money there, and again, it's between adult social care and our ICB partners, and we're in the second year of that in that plan. So in terms of our utilisation of those grants, there are 4 areas in the main that we focus on for our BCF, and they're the ones that we're monitored again. So there's lots and lots of lines in there. But in terms of our monitoring, we're monitored around our avoidable admissions, falls, people being discharged back to their usual place of residence, if that's when they've been in hospital, and our admissions to long-term residential care. And again, for the discharge grant, there are 4 areas. So that's focused on reducing delayed hospital discharges, planning services in advance, so we avoid those and make sure we've got the right workforce in place, learning from the evaluation of the impact of things that we've done previously, and being collaborative, so sharing with our health and social care partners, so working in collaboration. So in terms of our return, the Q1 return did focus on the discharge grant, with it being quite new, so it was sort of more of an update against spend. There were some slight underspends, but that's because a lot of that discharge grant is focused on staffing, so it takes some time to implement that staffing and recruit into posts. For our Q2 return, against our 4 target areas, all of them were either on track or had already met target or exceeded target. So especially for our residential admissions, that's sort of the first time we've hit that target, so that was really promising. The only one that's slightly off target is our discharge to usual place of residence, but we do have a query with NHS England, because it seems to be more of a how we pull the data through as opposed to an actual issue with us being off target there. So in terms of our request to the board, it was to ratify the Q1 and Q2 return that have been submitted to NHS England, as Councillor already said. Thank you.
Thank you. Any comments or questions? Councillor Wilmot.
Yes. Although the performance indicators for avoidable admissions and falls and residential admissions met their targets, as you've already said, the discharge to unusual place of residence is still not meeting its target, despite it's definitely an improvement. I wondered what the reasons are that admitted patients with these problems, when recovered, cannot immediately go home. Is it because people living alone with no relatives to help can't get the care quick enough to move to the home, or is it a problem in the hospital? The paperwork that's required, although it does say here that they managed to recruit temporary posts to do that paperwork so they could improve the things, or is it obtaining a vehicle to take the people home? But it's no fun to be told you're going home at 7 o'clock in the morning, and you wait until 6 o'clock at night before somebody comes and picks you up, and you're not actually in the bed. You're somewhere else. They put you somewhere else, you know, and it's mind-boggling on that situation. I just wondered if anybody knew the actual reasons for that. I know that the residential admissions are meeting target, and it seems the expenditure, you're also doing it within the budget, which is good news, of course. So looking at the plan for discharging patients from hospitals is still a problem, and a serious partnership approach is essential to combat the problem. Otherwise, I'm quite happy with the recommendations, but if somebody could give me some information on why it's taking so long, from early morning till 10 o'clock at night sometimes, I'm told with some of the patients, because they just didn't, they haven't worked out a program for moving the person. I just wondered if anybody knew anything about that, because a number of people have got in touch with me about it. That's why I'm saying it.
In terms of the number itself, so that there's being off target, so we do have a query with NHS England. So our local data set that we use internally that we scrutinise as part of our discharge pathway gives a slightly different figure, which would actually put us on target. So what we do believe is it might be a minor, just a coding issue of where we pull the data from, hence having the query in. So I think once we've resolved that, we will actually be on target for that area. So although it looks ever so slightly concerning, it is only a couple of percent out, I think once we've resolved that issue, we should be back on track.
If I could just come back in on that, I'm just more concerned about these issues. Even though you are almost meeting the targets, there are people suffering because of the programme to get them from their hospital to the home. I just wondered if you knew anything about that issue.
I think that's one we'd need to take back to obviously the teams that work within the hospital. It's a bigger piece of work and a bigger programme rather than something that I could personally answer. It is that partnership approach in there, but by all means we can take that back and feedback to the board.
Thank you, Tina.
Thank you very much, Johnny. A good detailed report. In terms of a couple of metrics here, the avoidable admissions and falls, and I'm probably looking at Victoria here, is because she knows where I'm coming from. Because one of our priorities, when I mean our priorities, is from NHS priority in terms of frailty, is a big piece of agenda. And looking at the schemes, I think it's a very descriptive. I mean, there's a brief description, and there are lots of schemes over there. Understanding what are the success stories, which ones are really delivering in terms of the, particularly from those two areas, which is because when we look at it as a system, the frail, because we've got healthy our population is an aging population, and one of the metrics is about assessing the frailness as well, because again over the age of 65 over here, and the more frailer you get, the high risk of admissions, the quality of living, and the impacts which goes so on and so forth. So therefore, based on this, because of the work we are doing as part of the frailty board, how do we link in with the sort of wealth of information you have with these schemes? What sort of evaluation, if it has been done, how can we share it? And then if where it's applicable, scale it across as well. Because what I'm really keen is a lot of these interventions are non-medical, because often we tend to go with a very medical approach, which isn't sustainable. It doesn't empower populations. It doesn't promote self-care, which we discussed previously. So therefore, what of these measures have been evaluated in our real success stories? Can we learn and share and scale across our system? So that's a bit of a challenge, I think, for us collectively from the ICB, but really looking forward for your help in guiding us as well.
So from my team's point of view, we are now sitting obviously as part of the Frailty Board and various other work streams within there. So we've started some mapping with some members of the team to start to feed in what we are doing, what impact we've started to have. So we've started to do some of that information gathering with board members. So we should be able to do that through the boards themselves. But you know, if it's something that would be of interest to come back here, I'm sure we can start to gather some of that together. Through those different board approaches and bring it back.
Thank you. And Sarah?
Better Care Fund, it's one of those things that it comes in because we're responsible for it. But I don't think many people really understand what it is and what it does. And I think that's part of the issue, is that we get to ratify retrospectively because of the way everything happens. So it's already happened by the time Anna and the team get to put all these wonderful figures together and send it off to NHS England. And I think for me, exactly what you said, Talan, you know, I want to know, is it making a difference? The funding is significant. We're talking several million that's been put into this across the ICB and local authority. That funding is then used to cover all sorts of different services, including non-statutory providers who are putting in all sorts of different interventions to try and get people out of hospital quicker. So, you know, for me, as somebody who's a statutory member of this board and therefore responsible for this, I sort of feel like I want to know I think the reporting structure, to be honest, whether you can read it or not in this format, is really difficult. And it's what you've got to send to NHS England. What I think this board needs is something that's different, that actually starts to show us whether or not we're making a difference, whether we're stalling, where there are areas that we as a partnership, again, coming back to that, we're a partnership, can actually work together on to sort of, you know, oil the cogs that maybe need oiling look at where we could actually put some effort towards supporting our social care colleagues, for instance, in different ways. You've got, Daniel from the VCSE Alliance, who's now a member of this board. Where does the voluntary sector come into looking at how we support these initiatives? So for me, when I read this, again, I've read this every time. I used to sit in the city again. I'm one of those rare people who sits on both. So I do Better Care Fund in the city as well as in the county. And this is a joint approach. And I used to sit on a committee that actually made some of these decisions, whereas this has been delegated to the chair. We don't really get to see it as a board, where this goes and what it does. So I think we get the end result. So for me, I think, some sort of reporting to us that is not scrutiny, because I think that's another bit that we have to be really mindful. And I think Victoria's point earlier is really important, and I think we dip into it sometimes in health and wellbeing, is we're asking questions which are absolutely relevant questions, but is this the right place to be asking them? And how do we park some of those questions and ensure that our colleagues in scrutiny can take them forward to look into them? So for me, there's a call for reporting to us which is meaningful to us, that actually helps us understand how these several £millions worth of funding is making a difference in the system, and where as a partnership we can either improve that or celebrate it, and be able to celebrate properly what we've achieved, and where partner members who are involved in Better Care Fund delivery have got a way to sort of help, ask for help if they need it, or give us a strategic overview of what the barriers are going to be going forward. That's what would feel better for me at Health and Wellbeing Board. Scrutiny, which I sit on, I'd have a whole other list of questions. But for here, I think, you can see how much work goes behind this, Anna, and we've got to do it. But for us, it sort of feels like it loses its impact because it's data. Whereas I feel the narrative is really what will help us as a partnership going forward.
Thank you for that, Sarah. I think when we do the workshop and we talk about what we're going to do with the what next, I think that's where we'll have the conversations about when these reports come, how we change it so it adds more value. But Viv, do you want to add something?
Yeah, so I just wanted to highlight that I think it was last year, Naomi will correct me, there was an evaluation on the BCF. So it might just be worth it if we can circulate the results of that round to partners again, because certainly one of the things that did come out of that was how does the BCF have a greater impact and focus on prevention. So if I then come back to the previous conversations that we've had today, I'd be really keen to think around how are we as a board supporting driving more of a preventative approach through the BCF and thinking through some of our urgent care pathways, for example. And I think maybe that's a more fruitful and helpful conversation to have, rather than, and I know that we have to ratify them because that's what we've got to do from a statutorily point of view. But I think there's obviously appetite in the room to actually really understand the work that's going on, and that won't be limited to just the BCF part. So there might be something that we might want to think around in terms of how we have an agenda item that spans this area of work, that will give us a bit more granularity to understand then what happens when it comes through the BCF, but also we give us opportunities to start influencing where we can put more of that prevention and equity lens on, because I think that is where we can add a bit of value. So yeah, it's just a suggestion, and I don't know if anyone wants to add that. Thank you.
Councillor Jackson.
Thank you. I was going to share an anecdote which I think was shared last night at the Mammoth meeting that we were at. And in terms of is it making a difference, we were told at the Board of Governors at Sherwood Forest that the number of delayed discharges was at one of its lowest levels, and the patients that were still in hospital were there because they needed to be, because they were sick. So I think there will come a point, and the reason I share that is to show that something's happening, but also there's going to come a point where you can't get this any better than it is. So we need to be mindful that it will plateau at some point, because we've got a population that's older, frailer, sicker, that's going to be stuck in hospital for longer because they need to be. So I think we need to bear that narrative in mind, because there's always this narrative that lots of beds are blocked by people that can't go home, and it's not necessarily the reality. So I just thought it might be helpful to share that little anecdote. Did I understand that right, Councillor Eddie? Because you were in that meeting.
I was in the meeting, and yes, you were correct.
That is
They
what you said, isn't it?
yeah, exactly what you said.
Thank you. Yeah.
That it was, I think, a 4-year low.
Yes,
I think they
yes.
said.
So something is making a difference, but there are other reasons now why those beds are full of people.
Yeah.
Thank you.
Councillor Smith.
Thank you, Chair. Worth flagging on this point. So myself and Councillor Wheeler visited Kingsmill last month to look at this specific thing. And it's worth flagging to the board, if you don't know, that we have an adult social care team based physically in Kingsmill. And we join one of their meetings and they literally get a patient up on screen, patient's data, NHS, adult social care, and they all sit around and they hash it out. So yes, clearly there are issues, but the stuff is in process. You know, it's not something that nobody's tackling. They're working very hard. The team there are very, very passionate about it, and they are tackling it clearly as the data shows. So worth flagging, Chair.
Thank you.
Hi. Oh, sorry. Did you mean me? Sorry. Thank you. Yeah. So thank you, Anna. So we've worked behind the scenes on the BCF reporting, and I think myself and Anna are both in the BCF oversight group, which is like our collective city county planning meeting, strategic planning meeting, taking the findings from the review where we want to get ahead of the national template planning documents, which are always a little bit delayed than what we expect. And make sure we're kind of doing that bit more of that strategic planning ahead of time, together with the 3 themes in the BCF, one of which is prevention and isn't probably reflected well in the scheme labelling at the moment, and then the avoiding admission and the discharge. But those metrics are really interesting because they kind of, like you're saying, call to our frailty plans, and the national plan document, the template you fill, does quite cleverly already kind of lean us into the integrated care strategy. How do we link to that through our BCF, place-based partnerships and integrated neighbourhood teams? So it's all sort of in there for us to sort of knit together. So we'll do that. But I wonder if, like, in our planning group that we've just stood up to get ahead of the national templates, and in our end of year report, which is a kind of Q4 big narrative report that national team require of us, we can maybe provide us a bit more of that tangible sort of patient story, citizen story through the reporting, and that might be a good way to kind of end a report, prepares us for the next year's plan, so you're kind of a bit more involved in the strategic plan bit.
Yeah, that'd be really interesting, I think. Colin.
Thank you, Chair. And I think I support Sarah's point. In a few minutes, I'm going to raise my hand as a statutory board member and support the recommendations of the report. Do I do that with an informed view about understanding what I'm raising my hand to do? Probably not as much as I should. I don't know at the end of Q2 how far we're through the fund of 125 million for the year. I don't know what happens to the fund at the end of Q4 if we haven't spent it. Does it get carried forward? Does it go back to central government? Is there a reserve? How much is that reserve? And I think that if this board is responsible for the Better Care Fund, I think we need to, I own it myself. I need to understand it better, in order to feel that I'm making an informed decision when I raise my hand, because this is serious money.
No, thank you for that. We'll take those comments on board, and I think we'll work something out for next time, and then we'll work on that on the background. Are there any other comments or questions? Helen?
Just one thing, again, building on Sarah's point about, and I'm reassured with Naomi's response there, but I wonder, in terms of making every contact count training, can we ask that the BCF funded services receive that early on in the programme, so that actually we're looking at how these services are working rather than just the numbers, and that would be a really good way to do that. Thank you.
It says we can look into that, so we'll come back to you with that if that's okay. Any other comments or questions? No.
So can I just?
Oh, sorry.
Just because just picking up Colin's point, and I do agree. I think I've said it. I'll say it again. Every single penny that we've got available to support our communities needs to be used in absolutely the best way possible. Just going through this, and I must admit I've not seen this level of granularity, or it's my fault probably not taking note, so I'm putting my hand up to that. There is an awful lot in here that I think we need to review, given the fact that if we agree what our priorities are and we're going to be laser focused on achieving those outcomes, we've got to make sure that the way that we spend our money is aligned to do that absolutely wholly and completely. And I would suspect at this moment that there's some scope in here to maybe give that focus a little bit more attention. So I think there is something that we need to do outside this room to really review what we're doing with this Better Care Fund, and each and every line needs to be validated and understood. Is it adding value to our collective responsibilities and goals?
No, thank you. We'll take that up outside the room if that's okay. So can we vote on the recommendation outlined in the paper, please? Everyone okay? Hands up if you're in favour. Thank you ever so much. I realise it's 3:30 already. So next item is the work programme, which is the final thing to look at. So it's on page 79 to 84 of the pack. Are there any other recommendations or anything anyone would like to add? And can I have a second of the recommendation on page 8, please? Thank you. Any comments or Councillor Wilmot?
Afraid I've got to come in on this again. Can we have a look at the update on the Campbell Centre for Hucknall, if that's possible? Even if it's saying it's not going to happen, we need to know where it is, where we are at this situation.
I think that was something that was brought up at health scrutiny. Yeah, so I think it's not for this committee, but we'll talk offline if that's okay. Any other comments or questions? Oh, Viv.
Just one comment, just to think around this is, as we go through the review and we think about the first paper that we had here, we might need to think around how we just keep this a little bit flexible, because once we're clear on what our priorities are, then we will need to think around how we hone in some of that, and also thinking around, we've had a lot of discussion around how we get the most impact out of the JSNAs. It may be that we think about a slightly different approach in terms of how we're getting sign off for those and how we're translating them from a really informative discussion into an action focused discussion. So I think if we can just agree some sort of flexibility that will align with the review, that would be really helpful, if that's okay with partners. Thank you.
Councillor Garland.
Just following from the really excellent discussion about Better Health Care Fund, I just noticed obviously it's on the work programme. Should it be brought forward those 2 months so that discussions that you talked about could be had? March, it's the next 2 quarters are on for March, and
we can have a look, can't we? I think we'll have a look at the statutory duty that we have, and then we'll also have a look, taking on board comments that have had today about what we add value to. So we will do that out of the meeting. And any other comments? No? Well then, thank you ever so much, everybody, and have a safe journey home.